you talk about this as a blue ocean opportunity versus red ocean sometimes when you talk about PHN. Can you elaborate on that a little bit?
Sure. The today the patient's journey is 6-7 years. It's convoluted at best. It could be the neighbor telling you they go here, and for those 2 hearing losses could be simple, and where that one person goes, they have the level of care that meets their needs fine. This other patient might have more complexity to their hearing loss and greater needs, and maybe that's not the right place for them. Some people go straight to the ENT, and we work in the ENT space, and there's certainly lots of patients that didn't need to be in an ENT office. Obviously, there was no pathology involved with their hearing loss. It was sensory neural, and they may be going into a little bit more expensive channel to get treated in the same way they could have. And that's a cost on insurance. And there's a lot to be discussed about, that channel. Obviously there's people who need to be in that ENT office, but it's not all the patients that end up in there necessarily. So, so we felt like the blue ocean opportunity was to provide almost a simplified pathway to where you go in, you get screened, identify whether or not a patient has a hearing loss, whether they do or don't, at least from a preventative standpoint, start educating that patient at some level of, requirement, based on their needs. Keep up with annual checkups, become a regular routine along with the other wellness visits that they make, include hearing with it. And if the patient does have a hearing loss, that the doctor's aware of it, and could it be associated with other comorbidities, that would be important. And then lastly, when they do have a hearing loss, to be able to provide them the options, to treat that loss. If it needs to be referred out, then make that referral. So it's really more of a 3-step process. It's get screened, educated, and get treated if need be.